Go ahead, sir.
Hello, a very good afternoon to everybody. Today we are going to talk about nutrition in fertility. September is considered as World Nutrition Month, and it's very important for us to talk about a good diet, good nutrition, and its importance in fertility. Welcome, I'm Dr. Nilesh Balkawade, Clinical Head Oasis Fertility, Pune. Here at Oasis, we strive hard to give fertility outcomes to all patients who come to us. This of our treatment would be incomplete if we don't give a proper advice on diet and nutrition, which is related to fertility and subsequently in pregnancy. When it comes to fertility, may it be male fertility or female infertility, the diet forms an important aspect of any form of treatment. Because unless and until you had a good dietary regimen or a good nutrition, good health, and a good general well-being, be you cannot have a great success in fertility treatments as well. So improvement in the nutritional status and the health per se is very important when it comes to fertility. So once we consider female fertility, what is nutrition? Nutrition is what gives nourishes your body, gives important nutrients to the body so that there are no deficiencies and the body functions well. And once we talk about nutrition, it is the basic protein, carbohydrates, and fats which are important. But along with that, certain amounts of vitamins, minerals, a good water intake, and antioxidants are also essential when it comes to the nutrition part. Once it comes to female infertility, in females we have patients who will have problems with their ovulation and uh, oocytes, that is the eggs. There can be problems with the uterus and the endometrium. So accordingly, these patients can be advised nutrition. We have seen that the pandemic or epidemic of PCOS has increased. So, because of the changed lifestyle, sedentary habits in the childhood, and probably genetic incidents, all this has led to an increased incidence of polycystic ovarian syndrome in many women. And once it comes to polycystic ovarian syndrome, lifestyle forms an important aspect of management, and most important part of management will be nutrition. So we'll be talking about nutrition related to the PCOS now. So in PCOS or polycystic ovarian syndrome, we have hyperinsulinemia, that is high insulin levels, hyperandrogenemia, that is high androgen levels, and along with that polycystic appearance of the ovaries. Patients will have irregular menses, infertility, male hormone related problems like acne, hirsutism, alopecia, all this will be there. And therefore, the basic cause, that is the hyperinsulinemia or the high insulin levels, needs to be taken care of. And for this, food products which lead to high insulin levels should be avoided. So simple carbohydrates, foods like sugary foods, uh, chocolates, bakery items, or foods with maida which have a high glycemic index should be avoided, so that foods which have high glycemic index are going to cause a phenomenal increase in the insulin levels and lead to hyperinsulinemia. This hyperinsulinemia is later on going to manifest and cause more release of male androgens from the theca cells of the ovary, and this will cause hyperandrogenemia in turn, and this vicious cycle will continue. If you want to break the cycle, a food which is devoid of the simple carbohydrates should be taken. So, which food items should we have seen which food items we should avoid. So, which food items we should take or consider taking them in PCOS patient is complex carbohydrates and a high protein diet. These foods are going to utilize more energy, and these are utilization of more energy is going to decrease the insulin levels, and this is going to help for for treating the PCOS per se. Along with a very good diet, which we have seen, a good exercise of high intensity, that is the cardiorespiratory exercise for 45 minutes, is mandatory so that the insulin levels come down. So, a good nutrition includes this comprehensive diet plan, and it should be supplemented with a good exercise. Friends, when it comes to PCOS, we have seen that the diet is important, but we can see the other extreme, that is poor ovarian reserve patients. So those women will have low AMH levels. So basically, these are the women who also need good quality diet so that the egg quality is better. We see that in patients of poor ovarian reserve, the AMH is low, the anti-follicle count is low, and these women usually have the residual oocytes which are present, and the qualities tends to be little lower, and the results of treatment also tend to be lower. So even in these women, food items which are having high glycemic index and fast food and oily food, these should be avoided. And foods which are having the antioxidant capacity, the more intake of these food items should be practiced. So more of salads, more of fresh fruits. Then the diet should be containing uh, lactobacillus, that is the natural bacteria which are there in the curd, buttermilk. This should be there. So all this diet is going to help. Along with that, good quality water intake should be there. Even the water content from the fruits is also important to give and energize the ovaries. Along with this, in POR patients, we should also be supplementing with some form of exercise so that the blood flow to the all genital organs remains in a healthy state. Friends, along with this, we have patients of thin endometrium, where again some amount of dietary modification can help. So, foods which are rich in vitamin E, especially would help. Fruits, and antioxidants would especially will help. And again, a very good water intake would definitely help these patients in improving their status. Along with this, in female infertility, we have on patients who those who have these ongoing problems of pre-existing diabetes or hypertension. These should also have good nutrition and titrate this nutrition with a good dietitian so that the diabetes is controlled before they go into the treatment. If they are having hypothyroidism, then the food items nutrition should be accordingly taken. And if they are having hypertension, such salt restricted diet is necessary for this patient so that there should be no complications later on by taking treatment. This part uh, takes care of the female infertility. Now we are going to come about and talk about the male infertility. So patients who have problems with the sperm count or semen analysis, that is the count, motility, and morphology, some amount of nutrition also is going to help along with medicines. So not only is that medicines are going to help, but nutrition is also important for men, and therefore they should not neglect this part of important part of treatment. So good diet, which is again rich in proteins, rich in antioxidants like fresh fruits, salads, lots of water intake, then 1 tablespoon of honey, which is going to give them natural fructose, and then food items such as curd, buttermilk. These are going to help. Lots of water intake is going to help. Avoiding fast food, avoiding too much preservatives in the diet, like packed food, processed food, should be avoided. What Drinking through plastics and eating through plastics should be definitely avoided, because we are seeing the problems of those sperm count, motility, and also with the eggs in females is more so because of the changed lifestyle and the changed habits, like use of more plastics is also one of the reasons, and therefore this should also be taken care of. Friends, once it comes to nutrition, we should also talk about avoiding addictions. So, what we should not take is important, and therefore avoiding addictions is again important. So, avoiding smoking, tobacco, which cause much damage to the gametes, that is the ovary, eggs, and the sperms. Along with that, problems with the uh, uh, this sperm motility, morphology is going to be more with this type of food items, and therefore this should be avoided. And uh, alcohol intake should be kept to the minimum, bare minimum, so that then again this doesn't cause any damage. Because a single, even it is said by the WHO that even a single drop of alcohol can cause problems, and therefore a totally restriction should be followed. But uh, at least uh, the allowance with that, the daily recommended allowance what is there, it should not be exceeded more than that. So that should be followed. So that is again important aspect of treatment. So nutrition is an important aspect of treatment of any fertile couple. And in this September month, can we pledge to have a very good nutrition, so that we are helpful in achieving our dreams of fertility come true, dreams of our parenthood come true. Friends, for that, I conclude today's session. Any of your questions related to nutrition would be greatly encouraged. Below is given our helpline number where you can connect to us anytime and ask for a free consultation. You can visit any of our centers in Pune. We are situated in Wakad and Karadi. You can connect to us for a free consultation. Uh, that's all for now. Thank you so much.